Good morning. Happy Monday. I have Neuro Coffee in hand and it is perfect. Okay, speaking of Neuro Coffee, I get this message from my buddy Christian Wonders over the weekend, and he says, hey, you got to go check out Logan Morrison's Instagram page because Logan does coffee reviews as part of his Instagram. And if you don't know Logan, Logan's the first baseman for the Milwaukee Brewers, so obviously great athlete and an interesting human, to say the least. But anyway, so Logan did his Neuro Coffee review, and he happened to throw in a little shout out to yours truly, which I thought was awesome. So he did the Bill Hartman imitation with the "It is perfect" phrasing after he taste tested his Neuro Coffee. So I thought that was awesome. Logan, I appreciate you so much for doing that. Very cool. So now it seems that I'm going to have to be a Milwaukee Brewers fan because lost Josh Lindblom, pitcher for the Milwaukee Brewers, and now Logan Morrison of the Milwaukee Brewers are my two favorite baseball players. So I will be a Brewers fan this season if we ever get to see some baseball. So that's exciting. Big deal today. First Q&A for iFast University members only. So if you're not signed up for iFast U, I would suggest you do so very, very quickly because we're going to do that show at 2 p.m. And again, like I said, members only. We got the coaches call, the coffee and coaches call at 6 a.m. on Thursday morning as usual. So please don't forget about that. And yesterday, had a big call with the intensive folks. So the intensive group, anybody that's gone through the intensive gets to participate in an ongoing discussion group where we do case studies and reviews and strategize, and we look at different presentations so we can keep on learning and applying the model. And there was a question that came up yesterday that was related to some videos that I've already shot, but I thought it'd be a great way to lead into the week because I think it's a pretty common question as to what differentiates the medial knee pain from lateral knee pain. So that was the question. And so let's go through that sequence because I think that if you see how these presentations arise, it will help you understand the strategies that are explained in the videos that I've already posted. So those videos are up on YouTube, depending on where you're watching this. They're also on Instagram, but they're probably a little bit easier to find on YouTube. The thing that I want you to understand when we're dealing with this medial or lateral knee pain is that it is the result of a loss of relative motion somewhere, and that somewhere is typically going to be from the ground up. So we're going to see it show up in the foot a lot. And so if we look at the way that the foot moves through space, we've talked about the heel rocker, ankle rocker, toe rocker thing. So as we hit with the heel rocker and the foot goes to flat, we've got this supinated position at the subtalar joint. So we have no relative motion between the talus and the calcaneus. They're moving together as one. As we move through this middle propulsive phase, this is where we start to see the relative motion. So that would be typically described as closed chain pronation. So we have the talus and the calcaneus moving in relative motions in opposite directions. And then as we move through the late propulsive strategy, we get the calcaneus and talus moving again together with no relative motion. So typically when we have knee pain, either like a medial compartment load or a lateral compartment load on the knee that results in pain, we have this loss of this middle propulsive phase. So that we have a loss of relative motion. And then what's happening is that the lower extremity is trying to recapture some form of relative motion somewhere else. So when we talk about medial knee pain, we're going to see an early propulsive strategy in the foot. And what this is we look up above at the pelvis. What we have is the left side of the pelvis that's trying to get ahead of the right side. And so if we can't delay that propulsive strategy on the left side, we're gonna plantar flex, and we're gonna try to hold ourselves in this early propulsive phase. That's gonna be medial knee pain. If we continue to drive the left side forward and over, so this would be typically that somebody's going to be anteriorly oriented in the pelvis and tipped up on an oblique axis. It's going to drive even harder, and it's going to push us anterior and lateral over the foot, and it's going to drive us towards a late propulsive strategy, and that's going to result in lateral knee pain. So let's see what that looks like at the knee. So if I take a knee, I'm going to move the patella out of the way so we can see the knee joint. So if I'm utilizing this early propulsive strategy at the foot to reduce relative motion, that's going to result in a tibiofemoral ER representation. If I continue this turn of the tibia into ER relative to the femur, I'm eventually going to hit a constraint, and that's going to be a medial compartment load. So this is where we're going to see this medial knee pain show up. Now, if the pelvis is driving me forward even farther over this extremity and I'm hitting the late propulsive strategy, I'm maintaining the early propulsive strategy, but because I'm moving into a late propulsive foot where I have the loss of relative motion, what's going to happen, it's going to start to drag the femur with it. And so now the entire system, so the whole lower extremity is going to start to behave as a single segment, and it's going to drag the femur into ER along with it. So this is where we're going to start to see lateral compartment sensitivity. So the LCL will be sensitive, the distal IT band will be sensitive and probably produce pain as it pulls against its attachments on the lateral knee. You'll see lateral thigh pain, a lot of sensitivity down the lateral thigh. And so this is the distinguishing characteristic, again, for medial and lateral knee pain, whereas this would be where the tibiofemoral ER relative to the femur is going to be medial compartment load and medial knee pain, but if the whole thing starts to move as a system, it's going to move into a more laterally loaded strategy, and you get the lateral knee pain. Either way, the goal is going to be to try to restore the relative motion at this segment. So we're going to have to start this from the ground up. The typical places where you're going to want to be able to do that is through that middle range. So we're going to use a lot of knee flexed positions. So again, these are your split stance, half kneeling kind of positions is where you're going to start to recapture these things. So we can utilize that relative motion again. Rather than going through each one of these, they're already laid out for you as far as strategies go. I think that each of the video series were 3 segments. 3 segments for medial knee pain, 3 segments for lateral knee pain. So please go check those out on the YouTube channel or search for them on Instagram. I hope that was helpful for you to distinguish between the 2 ways that this is going to be represented. But just remember, whenever you lose that relative motion, something else is going to have to try to substitute for it, and that's where you're going to get loading strategies that might result in pain. Have an outstanding Monday. Thank you again to Logan Morrison for the shout out. Please go check him out, and you guys have a great day. I'll see you.